Welcome to Adjusted Reality, a podcast series trusted by the adjusted and brought to you by the Foundation for Chiropractic Progress, where we learn from athletes, celebrities, influencers, and healthcare professionals about how to optimize health in a fun, relatable way. Join me, Dr. Sherry McAllister, as we welcome chiropractic neurologist Dr. Sergio Azzolino. Dr. Sergio is an internationally respected clinician who has dedicated his career to helping patients recover from brain injuries and complex neurological disorders. He is the president of the American Chiropractic Neurology Board and has served on that board for 27 years. He's currently on the California State Chiropractic Board, appointed by Governor Newsom, and previously appointed by Dr. Jerry Brown, where he served for 9 years. He is a pioneer in functional neurology and integrative care. He combines advanced diagnostics, rehabilitation strategies, and non-pharmaceutical treatments to restore brain and body function. He's completed the Global Clinical Scholar Research Program through Harvard Medical School and has published many papers with one of our esteemed colleagues and father of functional neurology, Dr. Frederick Carrick. Over the years, Dr. Azzolino has worked with patients from around the world, including professional athletes, using a unique brain-based approach to optimize recovery and performance. Passionate about education, he also trains physicians in innovative methods to better address neurological and chronic health challenges. I will tell you, as a listener today, this is an absolute treat. It was not easy to get Dr. Azzolino on, but I'm delighted. Welcome to Adjusted Reality.
Well, thank you, Dr. McAllister. That was quite kind of you, and I really want to give a heartfelt thank you to you for all that you're doing to just bring better light to what we all do and how we could help patients. So you've done a wealth of good for patients, for our profession, and healthcare at large, and so thank you so much for all your efforts.
Well, I appreciate that. And I think that's one of the things is our profession really is patient-centric. And I know after talking to you on several different conversations, you really have focused your time, your talent, and your research into making sure we can improve the broader base of patients that are suffering, and then also patients that want to optimize their performance. So I want to kick this off because a lot of our listeners who've been with us for a while, and we appreciate you, they first want to know what drew you to working on functional neurology and brain health.
Well, I got into chiropractic as many of us have because of our own little miracles that we experienced. And I was in an entirely different profession, going down a path of dealing with chronic stomach ulcers and digestive issues for many, many years. And I consulted chiropractors early on in my late teens that explained the connection of the nervous system and the structural aspects of the spine and whatnot. And long story short, after receiving some care, it was life-changing for me. So it was life-changing to the point that where I wanted to just go back to school, learn what I could, and hopefully deliver the same benefits to somebody else. And with getting started in chiropractic, there was such a great breadth of information and depth and whatnot that I just got sucked into it very quickly and saw many of the miracles that many people were having on a regular basis. And I saw many other patients that were dissatisfied with things not working and antiquated explanations and whatnot. And so I was very fortunate to meet my mentor and now research partner, Dr. Frederick Carrick, in my first quarter of school. And that really changed my life forever because Dr. Carrick at the time, which was over 30 years ago, was explaining how the brain interacted with joints and muscles, how the things that we did with our body and our structure affected different aspects of the brain. And so that was a step of once I took, I could never look back. And from there, it really allowed us to be much more specific with our care and our delivery, our diagnostics and whatnot. And so functional neurology has become my life, and I'm very grateful for that.
Well, it does sometimes take, unfortunately, miracles in our own lives to really appreciate the beauty that you can bring forward when there is misconceptions. And that's one that I want to break today, because a lot of people think of chiropractic as bone doctors. And that is a myth that we are trying really hard to shed. So for the listeners today, I want to ask you, how do you see the departure from where we were, which is, oh, they're the bone cracks and they're really just about the bones, to where we are today, which is really building on the nervous system and brain health?
Well, I think we're very fortunate in that science has caught up to a lot of what we do. And as you are well aware, some of the founders in chiropractic were really looking at the interaction of the structure and how if things were not moving correctly or quote unquote, you had a subluxation, that would pinch a nerve and that would impede impulses in your nervous system and whatnot. Now, we know that doesn't always happen. That's a small percentage of the time when people have degeneration in their spine, when they have a herniated disc or so. But more so, the science has caught up to educate the world that structure is extremely important when it comes to function. It's important when it comes to cardiovascular function, respiratory function, and neurologic function. So there are many different professions that are looking at that now. It's not just chiropractic. Chiropractic or chiropractors have had the good fortune of being trained in that. We should be experts in biomechanical function and experts in movement patterns and whatnot. And with correcting movement patterns, with correcting joint motion, with improving joint function, we have a great effect on the cardiovascular system. We have a great effect on the nervous system. Everything we do, from moving our eyes to turning our head to moving our hands to any sensory experience we have, from touch to exercise, all has an effect on the brain, and it all goes through pathways that pick up information from the environment, from our eyes, from our inner ears, dealing with hearing, dealing with our vestibular system, and from movement of joints and muscles. So we are creatures that were made to move, and we have to continue to move. And in moving, we should really focus on optimizing correct motion and function.
I think you really said a key aspect of this, which is movement. Many people really are sitting behind their desks for 6 to 8, 10 hours a day, especially where you live, which is there's a lot of technology around, but most of the people are sitting at their desks. And we have to reflect on how that impacts our health, especially as we start to get older, because where neurology is today, we're starting to learn so much more about the function of the brain and how neurological health really does tell us how we're aging in the longevity spectrum. Can you share where you've learned over the last couple of years some of the research and what that makes you think of when you start thinking about people that are stuck behind their desks?
Well, we know sitting is the new smoking. You've heard that term, I'm sure, that phrase. And not to put you in my age category, but decades ago, if someone had a stroke, we unfortunately would see some paresis, which means weakness of function, or possibly, paralysis throughout, a side of the body. And oftentimes people thought, well, that happened and that's it. And there was no meaningful approach to try to restore function. Now we know that someone has a stroke, they're in therapy immediately to try to restore some function. And the brain is very malleable. It's very adaptable. It's a dynamic organism or organ, I'm sorry, that is constantly receiving information from the environment and making the appropriate changes. So we oftentimes will see people regain function following a stroke. We also know someone can have open heart surgery and they're not lying in bed for 3 or 4 days. And that's not just because of having bad insurance. It's because it's better for them, their body, their healing to be up and moving and on from there. So we know throughout all of healthcare sciences that movement is key. But what we really want to do is focus on correct motion. And I think that's where the chiropractor has had a great emphasis and a great ability to really help people is we want correct motion, not just generalized motion, because a car accident puts generalized motion into a spine. Much of that is pathologic. It's inappropriate. A chiropractor should be putting correct motion into a spine. It's not a matter of cracking or manipulating a joint. It's about assessing the appropriate mechanics and restoring those, which is correct. If you move a joint incorrectly, you'll activate pain fibers. If you activate pain fibers, even though one's not feeling pain, those pain fibers come into the nervous system and may increase one's blood pressure. It may change their autonomic function, which is an area of the brain that regulates your organ system. If you have correct motion, as you would, for instance, with exercise, the long-term effects of exercise are to lower blood pressure, lower heart rate, and improve digestion, improve mental health. And that's all because of joints and muscles moving appropriately, activating what we call receptors that increase stimulation into the respective areas of the brain.
This is one of those moments in looking at the brain more now than ever before in history as a living, breathing entity, meaning that it's not stagnant. It doesn't stay the same. You weren't born with the same brain you had, obviously, when you were under the age of 2. We grow, and when we grow, every piece of us changes. And I think one of the beautiful parts is you recognize the change and you understand what degenerative changes can happen. It doesn't just happen to our bones. I would love you to talk a little bit about what happens when we start thinking about our brain in terms of both the regenerative properties, meaning we're building, versus the degenerative properties, meaning we're starting to lose activity. And what kind of activities do we lose?
Sure. Let's go back even further. The developmental aspects, because from the time of conception, your mother and father's health status has an effect on the genes that they're imparting on you, as you know, and development begins in utero and it continues throughout most of your early decades until, some say 25 years of age, for instance. This is an oversimplification, but your brain is developing early on and it's going to develop according to the environmental stimuli it has. If you're here in the United States, you're going to learn English. If you're in other countries, you may learn a different language. It's just the input that's going into your brain that's dictating what it's going to do. So if you're in hopefully a healthy environment, which unfortunately we know many children do not have that benefit, if you're in a healthy environment, or nonetheless the environmental aspects are going to have an effect on your emotional psyche. They're going to have an effect on areas of your brain called your limbic system that deals with primitive emotions and the emotional motor interface, if you would. Your nutritional status. We know mothers that unfortunately are in more polluted areas, closer to freeways, don't have the same, slower socioeconomic status, may not have the same access to good nutrition. They're in environments that have more pollution. All those different aspects have a great effect on development. And certainly the things that you do throughout your early childhood make a world of difference, from the sports that you play to the activities you engage in. When we were younger, in my generation, I'm in my mid 50s, we were out all the time playing. It was an extreme rarity. There was nothing to watch on TV, so there was nothing to play. And Atari, wasn't anything worth playing beyond one or two times. It was so basic. But nowadays, we see, unfortunately, these children are sitting behind computers and they're plasticizing, which means the input that you get into your brain dictates how nerves grow. They're plasticizing their brains in a particular fashion. So developmental aspects are far reaching early on. And we see, and I personally treat a lot of children with developmental disorders, from autism to learning disabilities to ADHD and whatnot. And we look at these things and assess an individual's function to determine what parts of their brain are working appropriately, which ones may be a little developmentally delayed and may not be age appropriate. And we could certainly dictate, we could guide, we could improve stimulation into those areas of the brain and create a very structured rehabilitation program to maximize that child's brain function. And we see far, far reaching benefits with many kids, pulling out of these conditions are no longer labeled as autistic or whatnot. Autism is not caused by one thing and one thing only. And I know there's been some discussion in the media recently on that. And I haven't heard any reports today that the president was going to share, but it's not caused by one thing in my experience. There are a multitude of things that can cause it. So as we go throughout life, our brain is constantly maturing and developing. everything from the speed of our eye movements, the accuracy of our eye movements, our hand-eye coordination, our postural tone, our speed, our reaction times throughout our body. All of these different aspects are maturing and maturing. And when we go throughout life, we can be exposed to traumas, physical, emotional. We could get in car accidents. We could be playing contact sports and sustain concussions. We can be, exposed to toxins. We could toxify ourselves with alcohol and smoking and these other things that can, unfortunately, cause some altered function throughout the brain. And all too often, many in healthcare, we're very fortunate. We have one of the best healthcare systems in the world, despite the many challenges that we have. But not too many people to date have been looking at the brain as a dynamic, fluid structure that can change. And so when we start to see degeneration, we can see degeneration of function starting early in the 40s and 50s. We see Parkinson's, one every 6 minutes is being diagnosed. We see, astronomical levels of Alzheimer's and dementia occurring. We could see a lot of these changes to those that are experts in looking at the brain functionally. And we have many of those in our functional neurology circles. We could see these changes happening early on. And the benefit of having yourself assessed by a functional neurologist is that with identifying these things early on, we could intervene and determine what may be perpetuating some of this cycle. You know, there's plenty of studies that have shown exercise has been one of the most effective things for depression and anxiety and whatnot. Well, that goes right back to the movement of joints and muscles. We know chiropractic itself, on the simplest level, has had tremendous effect with people in these circles and afflicted with these conditions. And if we understand a little more about the nervous system, we can intervene on a much deeper level also and have extremely profound changes on delaying some of these losses of function. There's just not enough people in healthcare right now to serve the many in need, and hopefully we could start intervening on these things, and people can be empowered to intervene themselves and maintaining a healthy diet and maintaining an active lifestyle, so that we have a responsibility to do so, to offload the burden that we're all going to be faced in a shortcoming.
That's a key aspect, is you said the word responsibility. It technically is the ability to respond to what you know when you know it. So when you know better, we hope, as a listener of Adjusted Reality, that you would do better. And sometimes that really is the adjustment that you know today can make a better future for you tomorrow. But who's going to walk the path with you? And that's such a beautiful piece to why we wanted to have you, is you're showcasing that the brain is an ever-changing, evolved organ, that it has inputs that can come in certain negative ways and certain positive ways. And that we're hoping we can do more positive than we can do negative. So our net balance at the end of the day is that we're actually doing very well. Our structure and our function are working together. But the blessing is you're doing the research so that the people can actually understand, from what we know in the research to what we can do utilizing that research. And one thing that you kind of touched on a little bit, obviously optimizing an athlete's life is a beautiful thing, especially if they're professional and they want to be, say, in the top gold standard for winning the gold medal. But there's also the everyday listener right now that's just trying to get through the day, and they've got brain fog, and they've got challenges with their sleep, and they're feeling achy and sore and tired. That's the listener that we really want to capture too, because brain health really is health care. What for you, two things. Number one, what are some of the technologies that excite you that have come out? And number two, when you see the technology and you put it back to looking at the patient, what are some of the simple lifestyle things that you've recommended that you've actually seen tremendous results with?
Sure. I think we're in a good place. We're a good place in our society because everybody's opening up their eyes to this, and it needs to be from every specialty. But in regards to technology, funny you should ask, because we're testing out a new technology right now that's going to really bring this to the everyday person and make life much easier. But in our practice, we rely a lot on technology. I've been in practice 30 years, so I learned how to assess these things without the technology. But now we have the technology to measure things and give us some objective measures, from everything from your sway pattern down to the degree per second that your body is swaying, your ability to stand still, your what's called your center of gravity. When you see an individual standing upright, everybody thinks they're standing upright. When you see them standing upright, how long can they stay in that position versus swaying? When you see an elderly individual that's rounded forward, they think they're standing upright also, but their center of gravity is off. There's a map of the world and a map of your body inside your brain. Those two things need to be in sync, and they're not always in sync. And so hence people start to move differently. We can assess movement patterns objectively now from how one person moves, their arm swing, their gait, and whatnot. But back to the technology, we use a variety of different things called a video nystagmography or video oculography. You may hear it abbreviated as a VNG. And we could put some goggles on you, measure your eye movements right down to the millisecond in regards to the speed, the accuracy of your eye movement to the degree. We can measure your visual reaction time to the millisecond also. We can measure your vestibular reaction time when we spin you. We put that together with your hand-eye reaction time. We can get your hand-eye coordination also. We test cognitive function with various different platforms that could very easily give us your working memory and your cognitive challenges with a variety of different things. And all of these put together give us a very comprehensive understanding of where your brain is in regards to health and disease, in regards to development or degeneration. And all of that allows us to be much more specific with prescribing treatment. And for the layperson, I tell people it's extremely valuable to just get assessed, because even if you don't engage in some treatment, when we see you starting to lose some balance and coordination, starting to lose some accuracy of your eye movements, starting to change your hand-eye coordination, well, there's things that you can do. You could sit on the sidelines and say, wow, this is aging, it's horrible. Or you could say, I'm going to engage in some things like hand-eye coordination exercises. What are a lot of people doing? I haven't done it yet, but the pickleball craze, I've seen not only pickleball take off, but I've seen, because of pickleball taking off, we have tennis players now back on the court. Any sporting activity is going to really challenge you to have some better eye coordination and hand coordination. Hiking on uneven surfaces is going to challenge your balance. It's going to challenge your center of gravity. Rucking, which I'm a big fan of. I do a lot of hiking. Putting a backpack on with weight, either because you're backpacking or because you're putting weight on, is not only good for your skeletal structure, because bone grows according to the stresses it's placed under. So if you load these bones, they will become stronger, but it also will load your spine. It'll force you to fire your postural muscles. That's under control of certain areas of the brain while you're going up or down stairs. It all is spectacular for just maintaining a brain at a challenged state. Because if you do not do these things, unfortunately, we see it all too often that people start to decline with their function. They start to trip and fall. Everybody's going to trip and fall eventually, and they have excuses why they tripped and fell. I tell patients all the time, the only reason why you fell, absent, a sinkhole or getting hit by a bus, the only reason why you fell is because your reflexes were too slow. So what can we do to speed up your reflexes? And there's things that people can do on their own on a daily basis to maintain an active lifestyle, to keep those reflexes stimulated. Otherwise, sitting in front of a TV will certainly not do it. Sitting in front of a computer will certainly not do it. And the concern is that if you wait too long, by the time you make the decision to say, I'm ready to do it, we may need to have you with a cane. We may need to have you with a walker. It may not be safe for you to go out hiking on uneven surfaces. It may not be safe for you to be playing basketball or pickleball or whatnot, because you may injure yourself.
That's one of the things when you see the commercials that say check with your physician before you exercise, now it's so much more real because now the listener can say, "Oh, I get it now." And you said something about lifestyle and the challenges that we have. Who walks with the patient through lifestyle changes? And that's one of the things that I really do love about healthcare is we have a sick care system where when you're diseased, you can easily get the care that you need. But are we not focusing on that patient centered preventative opportunity where we become proactive? So I love that you talked about pickleball because you're right. It is one of the number one new and growing sports. And it also brings together that beauty of community centered reality because isolation is just as bad as staying stagnant behind a computer because our body responds to the external environment and it internalizes it. Like you said, it's that plasticity. And if you stay focused on one thing too long, you're guaranteed to miss something else. And that's the beauty of having someone like you come in and proactively say, let's just get a baseline. We do it with so many things in our life. For example, our teeth. We want to come in, we want to take care of them, maintain them so that we're not at a place. And look, listen, think about this as a listener right now. I'm talking about teeth. They can be pulled out and replaced. Okay. It's just, they're there for mastication. But the reality is your brain is so much more because it reacts to timing. And like you said, the longer you wait and the more progressive decline we have, we may not get back to that spot. And then it does become, you want to get on a mountain bike with a friend and all of a sudden your balance is way off. Well, now you're going 40 miles an hour on a dirt road and your balance is off. That to me is a trauma waiting to happen. You've worked with some of these great tools and you've done a lot of advancing brain rehabilitation. As you see the focus for the future in especially kind of coming around to a different topic that I think a lot of listeners really don't understand, and that's a concussed brain. Many will ask questions in this area about what does it mean, what do I need to do, and how do I heal a brain that has been damaged from that kind of thing. I know this is not an easy topic, but it does come up a lot in the questions that I get after a podcast with someone who treats brain injuries. Can you touch just generally on concussions and then how does that impact their life after they even heal from the concussion?
Yeah, I'm happy to, and we'll try to make this simple. And for any physicians that are listening or practitioners, chiropractors of all different walks of life, we're making a great overgeneralization on some of these things, and I'm happy to go more in depth for that crew. And we have plenty of research published on these things. So when we look at a concussion, imagine it being the brain being a very complex network of highways or a scaffolding that's around the building. And I'm in San Francisco. We just had a nice shaker at 3 in the morning this morning, which many of us felt. And so that earthquake, if that happens to the brain with a blow to the head, can break down some of these pathways, can break down the scaffolding. It can cause a bruise on the brain. It certainly can cause a bleed, and everybody that has a concussion should be evaluated by somebody that's an expert in the area that can make sure it's safe to proceed with just rehabilitation versus having a scan of the head to rule out a bleed. Not everybody that has a concussion needs a scan of the head, but nonetheless, we see that. We see it commonly. And certainly somebody that's older, if you have older listeners, it's very important because our blood vessels become more fragile. We may be on blood thinners. And so elderly people are more prone to bleeds of the brain following concussions or falls. So nonetheless, when you disrupt these pathways, you cause a cascade of neuroinflammation. Inflammation in the brain that can be local, it can have far-reaching effects. Depending on your health before the concussion, there are a variety of different outcomes. If you've had infections and toxins, and we've published work on this looking at first of its kind paper back many years ago, where we found that many people that were not healing from concussions, a high percentage of them had Lyme disease prior that was not treated fully. And as a result, they had more inflammation in their brain already. So once they had the concussion, that inflammation took off. You can have different toxins in the brain, from metals to mold toxins. You can have a brain that was not as well developed, maybe had some ADHD where certain pathways were not as well developed. Maybe someone had some other injuries along the way. But when you disrupt how these pathways fire, you mechanically will disrupt them, you chemically will disrupt them, and you can have a decrease in function. You could have a decrease or an elevation in symptoms. Some of the most notable things people feel right off the bat are headaches, maybe a little dizziness, maybe a little fatigue. And to date, many in our system, with no fault of theirs, it's just the understandings have been different. I've been blessed once again to have been trained by Dr. Carrick, who hands down was one of the best clinical neurologists in the world has ever seen in our lifetime. And we started looking at function very early on. He trained us to look at function because your symptoms may be elevated, but the question is, what have you done? And what's the function? You have an earthquake. Well, the earthquake stopped. Now you need to assess the building and say, are things functioning correctly? Our rapid transit this morning was going very slow because there's a lot of networks of highways that thing and railing that thing's traveling along, and they wanted to go slowly to make sure that there wasn't any disruption in the tracks. So that's what we do with a concussion. We evaluate an individual to determine where their function is, because to date, most have been focused on symptoms, and they've been focusing on alleviating symptoms. Whether it's with medication or rest, whatever it may be, you can get one's symptoms to subside, but they may not have their function returned. And we published a paper several years ago also looking at the pupillary light response, and over 26,000 subjects, we can tell by the reactivity of their pupil to light whether they had a concussion or not, despite their symptoms. So I think the most important thing for people to understand is that, yes, we're concerned about your symptoms as we are with any injury, but more importantly, we're concerned about your function. And if you don't test for function, you're not going to know what you lost, and you're not going to know what to do to improve it. So we see many people years after a concussion say, well, I may not feel 100%, or maybe I feel pretty good, but they've lost a substantial amount of function, whether it's in control over their autonomic system, meaning their pupil, in control over their heart rate. Maybe it's their hand-eye coordination. Maybe it's how they respond to movement, and things have slowed down. We know that with hockey players, who I've treated many of, and football players, they tend to, and there's been a study published with this, looking at the changes of their eye speed and reactivity changes each season. And so it really behooves people to, number one, most importantly, before we even get to the concussion, if you can, do some pre-concussive screening. It's mandatory for many contact sports nowadays, and it would be wonderful if we had all kids do it, because if you're playing sports, it's not a matter of if, it's a matter of when you're going to sustain a concussion. And with some simple platforms, if you have pre-concussion screening, we know where your baseline is, so that if you have a concussion after, we could rerun the same tests, identify exactly where your deficits are, and be very specific with treatment, which will return you to normal function right away. If you haven't had the fortune of doing pre-concussion screening, at least get yourself evaluated from someone that's an expert to look at all these areas, because all too often we see people that say, well, I'm treating a concussion because I have them in hyperbaric oxygen. Hyperbaric oxygen is great. Been using it for well over a decade. It is saturating the brain with oxygen, which can help the brain heal, but it doesn't necessarily restore function. Doing nutrition, and good nutrition is great. It helps the brain heal. It doesn't necessarily restore function. Chiropractors work with necks, and it's extremely important because it's highly unlikely, if you have a concussion, you didn't do something to damage your neck and compromise the mechanics. And we should absolutely see a skilled chiropractor that can restore good function to the neck. that doesn't automatically restore function to the brain. So getting a proper neurologic assessment, obviously, I think the best people for this are chiropractic neurologists. We have hundreds of them through the American Chiropractic Neurology Board that are board certified and vetted. These people can act as a consultant to chiropractors, to any other physician out there, and just help to assess an individual and help them move back towards maximum function. Because what we can't afford to do, Dr. McAllister, is with every generation lose, or every decade lose a little function, lose a little function, lose a little function, because it's happening naturally. So we want to make sure we don't perpetuate that with having unresolved treatments.
One of the things that makes it so important to deal with experts is an Albert Einstein saying, which is, if you can't explain it simply enough, you don't understand it well enough. And I think with you, it becomes that perfect moment where we just guided our listeners from a place of complexity on concussions and making them aware that proactive screenings are really helpful. Plus, as we age, and we know now that unfortunately, we degenerate naturally, which is painful for all of us. We're all older after listening to this podcast, but we get to choose the type of treatment we desire. And so if you've had a concussion, if I heard you right, and we want to give our listeners hope always, you may have lost function, but that doesn't mean that you still shouldn't seek care. Because if I'm right, and I heard you correctly, Dr. Azzolino, is there's always room for improvement. Is that accurate?
Well, I'm sorry if I wasn't clear. When you lose function, that's temporary. If you get the appropriate treatment, our goal with treatment is to restore you to full function. And quite often, because people start to engage in looking at these things actively, we'll get you back to where you were, not only where you were before the concussion, but even better. Because the average individual has no idea about their hand-eye reaction time. They have no idea about their postural tone, their sway patterns. They have no idea about their muscle strength and reflexive actions and whatnot. So with testing these things, it allows us to be better. It's like an individual that engages in any new activity at 50 years of age. Whatever it may be, you're going to force your brain to shift, and you can actually make very meaningful impact in learning that new activity. But the benefits that you have are far reaching, far beyond learning pickleball, far beyond learning tennis. It's going to improve you for the future. So concussions can be treated to full resolution. And I just want people to make sure they're not basing whether they need treatment or not on their symptoms, that they're actually getting their brain assessed objectively so that they could determine what exactly they need to do to intervene.
Well said, because oftentimes, unfortunately, in the real world, we're looking for symptoms. We need to have an ache to go see someone. And that is so far from the reality. And that's why you're on Adjusted Reality today. And I know how busy you are, and I really appreciate you taking the time to really share with our audience a lot about how our brain is impacted, how we can have hope that when we get care, we don't wait and we don't let it degenerate further and further, that we actually can be a better us in the future than we are right now. That's the reality that changes for many people when they start listening to Adjusted Reality and hearing that the neurology is a fluid thing, and that we, as a lifestyle agent, someone who can actually change the way we look at things so the things we look at change, create a whole new set of skill sets that make us better than we are today for our future. If there was one educational nugget that listeners could take away from this conversation, knowing the complexity, the brain is definitely not a simple organ. And a lot of times we're still learning about the brain and what it does and how it does it. What would you want our listeners to take away from this particular conversation so that they can go forth into the future and really be the best they can be?
I really want people to be empowered in understanding that, yes, the brain may not be simple, but that's why some of us have spent our lifetime, 30, 40 years of studying this and being those change agents. So I want people to be empowered to understand they don't need to be scared if they're having brain symptoms. We can intervene, we can do things to maximize function. Let me use a simple example of brain fog. We have been dealing with people with brain fog for decades. Prior to COVID, many people were gaslit if they had brain fog. They said, well, you're probably depressed. Well, yeah, they may be physiologically depressed. Their emotional depression may be secondary to them having some deficits in their brain, some weaknesses in their brain because of a variety of different dysfunctions. And following COVID, I think many in medicine, many in healthcare, many in the world now understand that there was an infection that we thought was a respiratory infection, but actually got into our brains and had a cardiovascular outcome and also had some lasting effects in the brain with things that we call long COVID, which we can measure nowadays. And so it's a very real thing. It's a very real thing that we could objectify on neurologic testing also, along with blood testing. And so I want people to be empowered that when they're having symptoms, just because one doctor or another told you, oh, there's nothing wrong, that individual did the best they could with their limited knowledge. And we all have respective specialties. And so we have people that can assess your brain function, can give you a very accurate measure of where you're at in health and disease, and we can all improve. Whether it's an autistic child, whether it's a professional athlete that many of us deal with that just want to come in to maximize their reaction time, to improve their speed, to improve how they're perceiving the world, to an individual with degenerative disorder, or a captain of industry that just wants to have their brain firing at a better level. Our brain can be improved upon, and I don't want people to be scared and shy away from it, and to be empowered to take that next step to see what they can do to maximize it. And with that, we also need to be careful, because that has become the buzzword. Brain health, functional neurology has become the buzzword, and there are many people out there that are right back to, as we are always overstepping bounds and promising the world. We should see people that are qualified, board certified, that can actually give you an accurate and objective measure of where you're at in health and disease.
Extremely positive information. And I am so grateful that you've spent your time, your talent, and your wisdom in the past 30 plus years to really look at how the brain functions, how the neurology impacts both function and structure, and that we can't stand still in both in life and in healing. And that when we look at what our bodies will do, we have to reflect on what we're doing for our bodies. And that's, I think, one of the big pieces is you have to be proactive in today's world where we do have a lot coming down on us and we do have a lot of information being thrown. You have to get accurate, you have to get important, and you have to get well-vetted information. And that means finding a provider that can do that for you and with you and change those lifestyle pieces that can create havoc in your life. And I know there's going to be a book coming out sometime in the very near future. And I think we're going to have Dr. Azzolino back. Is that accurate? Would you come back when your book launches?
I would love to. I have more days behind me than in front of me, and I don't look at people looking at degeneration as a negative thing. We're fortunate that our bodies do what they do for us, because there's not a structure out there. There's not anything that man has invented or humankind has invented that will do in, as much as that we get out of our bodies.
We're blessed. We're blessed to know that you'll be sharing more information coming up. So if you've enjoyed this podcast, make sure you come back for part 2, because as soon as he drops this fantastic book, I already asked, will you come back? He said yes. And I am personally looking forward to really reading it, because I think we all have an obligation to not only ourselves, but our family, our friends, our community, to get the best, the latest, and the greatest information. Because if you're not moving forward, unfortunately, you may be moving backwards, and we don't want anyone on Adjusted Reality to do so. So thank you so much, Dr. Sergio Azzolino, for your time and functional neurology and how we are advancing our bodies through chiropractic care and being able to properly be aware of what's happening, why it's happening, and how we can be proactive in our health.
And thank you. The world needs to hear more of what you're doing. So thank you very much.
As always, I want to thank you for tuning in to Adjusted Reality as we spoke to Dr. Azzolino about his exciting career as a chiropractor in neurology. And we saw that there's always hope, that you don't have to think about symptoms, but you actually do have to be proactive. So is it not worthy today to get that checkup that you need to see where your baseline is? If we do it for our teeth, why aren't we doing it for our brain? And I think that's such an important aspect is find that doctor who will be able to help you in preventative healthcare rather than reactive healthcare. I think that's the most beautiful part of Adjusted Reality is we want to see you flourish. We want to see you better in the future than you are today, because we know that if we take action and we completely understand that we grow, and we can grow through what we go through, that's Adjusted Reality. Now, this podcast was brought to you by the Foundation for Chiropractic Progress. We know life moves pretty fast, and we want to make sure you never miss an episode. So visit f4cp.org/Adjusted Reality. You can subscribe to our newsletter. Interested in hearing from a specific guest? Well, you can also send us guest recommendations. And if you can't get enough of Adjusted Reality, well, I'm super excited to share that Adjusted Reality book is now available in bookstores and online. I want to make sure you order your copy today. And of course, when you go to f4cp.org/Adjusted Reality, you can find your copy. It's available anywhere you buy your books, Barnes & Nobles, Target, Walmart, Amazon. Don't be afraid to buy extra copies, because the more you share, the more you care. Don't forget to subscribe, share this podcast with family and friends. And as always, we love it when you rate and review. And if you're feeling inspired to learn more about chiropractic, or in fact, to find a doctor of chiropractic near you, you can visit f4cp.org/find a doctor. As always, we appreciate your support and look forward to checking in with you again soon.